Hi, everyone. Welcome. We are so excited to have you here for what will surely be a very informative and lively panel discussion regarding the gun violence crisis that is facing our Commonwealth. Just as a refresher for our audience, since I know that we bring in many people from across the city and the surrounding areas, some with a public health background and some with not, a quick refresher that public health is really a science for reducing and preventing injury, illness, and death, and promoting health and well-being among populations through the use of data, research, and effective practices and policies. And how do we address this public health problem? We address it like many others, where we come together with a wide-ranging group of expertise to determine what the problem is, identify key risk factors, develop evidence-based policies and programs, and ensure effective implementation and evaluation of those. And because the goal is widespread adoption of these strategies, as with everything else in public health, it is inherently a political issue and process because we're determining allocation of resources and policies that will have the best outcome for the largest group. So when we look at this crisis, much like many other crises, it requires engagement across sectors to try and bring in the best backgrounds and solutions. Every day, when we're thinking about identifying this problem and defining it, it's very clear we lose 100 Americans every day to gun violence. And whether it be from the mass shootings or community violence that we see largely on television or suicide that is not often talked about, the problem is on the rise. And this is what those slides are showing, that this is growing and growing. And I'm sure that our audience is aware of that issue. More Pennsylvanians are dying from gun deaths than motor vehicle related crashes. And these deaths are, again, preventable deaths through the science of public health. And if you're watching the news, oftentimes the story lacks the dimension of how gun violence is not just a Philadelphia problem, but it is a Pennsylvania problem. And those stories lack the dimensions around all of the crises that are facing every Pennsylvanian. And when we are thinking about this epidemic of homicide and suicide across the Commonwealth, the common denominator is access to lethal means. We see that where more guns are, there are more deaths. And when we were thinking about this crisis, we need to be thinking holistically. During the COVID-19 crisis, we've seen an increase of gun sales, and these are non-expendable goods that, once they're out and they're circulating, they do not go away. And so we need to be thinking about how to face this. So both as a country in a whole, and specifically in Pennsylvania, where we've seen large increases in gun sales, this is a crisis that we'll be facing moving forward. And our gun problem within the Commonwealth becomes everyone else's gun problems. We harm those within our borders. Guns within our borders harm other people. And so again, we need to really be thinking creatively, evidence-based to address this issue. I'm going to end on this slide where we think about the public health impact pyramid. The goal of public health and our public health approach is really to remove the burden from the individual through changing the context in which individuals and communities live in healthy and safe spaces. So we've brought together an amazing panel for you to talk across the practice of public health within our communities, within our Commonwealth to address this issue. So tonight you're going to hear from a great panel of speakers who are going to talk about what we are doing within Pennsylvania to create change. So without further ado, I would like to introduce our panel for you this evening. We've got Dr. Ruth Abaya. She's the program manager for the injury prevention program at the Philadelphia Department of Public Health. We have Dr. Eleanor Kaufman, who is assistant professor of surgery in the division of traumatology, surgical care, and emergency medicine at the University of Pennsylvania. We have Dr. Michelle Kondo, who is a researcher and social scientist with the USDA Forest Service. We have Mr. Khalif Mujahidi Ali, who is the CEO and founder of Beloved Care Project. And we have Mr. Adam Garber, who is the executive director of Ceasefire PA. So you're going to be hearing from a great host of panelists this evening. And we look forward to your discussions. Make sure that your questions, make sure you add them to the chat or the Q&A box, and we'll get to them at the end.